59-year-old Arthur Sebishinguzi, a resident of Maramba sub-county, is among those admitted at Kisoro Hospital. He is ailing with HIV and tuberculosis.
I have AIDS.
Just like other patients, he is receiving free ARV and TB drugs, which were purchased from the Global Fund vote. Despite TB patients receiving free treatment, the health ministry is yet to account for about $4 million, which is about 14 billion shillings. The money is part of grant from Global Fund meant to buy food for multi drug resistant MDR TB patients. The food is meant to help TB patients adhere to treatment and recover quickly. The Oversight Program Chairperson of Global Fund, Henry Magala, told NTV that the delay was due to procurement dogfights, but has been addressed.
Food for the drug-resistant TB patients has been an issue, but from the logistics side, from the supply chain side, there are so many theories or approaches that the government wanted to take.
We put in money for MDR TB patients to get food. They have never received food up to now.
There are reports emerging that high-profile health ministry officials have been fighting over the tender to supply food to patients. However, the ministry resolved to decentralize the management of the funds and allocated them to regional referral hospitals. At Kabale Regional Referral Hospital, there are 11 MDR TB patients. The hospital superintendent, Dr. Alex Edema, says despite receiving the money on Monday, a year later, they are yet to supply food since they have to wait for a technical team from the ministry to address the procurement process.
Now, we haven't started. We hope to start in the next visit. We are expecting a meeting with a team from the National TB and Leprosy Center, whereby we are going to discuss in more details how this food is going to be distributed.
Uganda currently has 310 MDR TB patients, and in Kabale alone, 5 patients have died since 2014 due to lack of this special diet meant to boost their immunity.
Many of them have finished treatment without getting that food. Many of them have died without ever eating that food. Many of them are on treatment right now.
This will be the second time the ministry has been accused of failing to utilize Global Fund money meant for MDR TB patients' food. In 2012, the ministry failed to absorb $3 million, which was returned to the Global Fund. The Director General of Uganda AIDS Commission, Dr. Christine Ondoa, on Tuesday revealed that a team of the Country Coordinating Mechanism for Global Fund, CCM, was in southwestern Uganda to examine the accountability.
Precisely that's what we want to establish. That is why we are here. There are programs that we have set in place, but we want to ascertain from the ground, from the people, from the leaders, from the community.
The CCM team, together with representatives from UN, also assessed the implementation of the Global Fund in the fight against HIV/AIDS and malaria in Kabale and Kisoro district. At Kisoro Hospital, over 3,000 patients from Uganda, Rwanda and Congo are enrolled on the HIV treatment program. Habad Ziwa, NTV, Kisoro district. Despite the HIV prevalence rates standing at 2% here in Kisoro district, health workers are worried that the high levels of ignorance among the locals here in Kisoro and the cross-border trade that has attracted sex workers is likely to accelerate the prevalence rates here in Kisoro district. Habad Ziwa, NTV, Kisoro district.